Chapter 1. Introduction to Renal Diet. How do the kidneys work? Depending on body weight, 4 to 6 liters of blood circulates in the body. Blood is transported to the kidneys through the renal arteries. Every day, about 1,500 liters of blood pass through the kidneys, which are purified by the work of about 1 million nephrons. Nephrons consist of small filters named glomeruli that separate water, salts, and impurities from the blood. Protein and blood cells remain in it. The filtered fluid, primarily urine, is transported through small channels. There are cells of a particular type, tubular cells, that cause water and salts such as sodium, calcium, phosphorus, and magnesium to return to the blood. The remainder of the fluid is excreted as ultimate urine. The amount of salt absorbed by the tubular cells depends on blood pressure and the concentration of certain hormones that affect the functioning of these cells. Thus, the kidneys regulate the balance of water and salt in the body. Conversely, the kidneys also have an effect on blood pressure. For example, when blood pressure drops, more water and sodium are secreted into it. The kidneys also produce a hormone called erythropoietin, which stimulates the production of red blood cells. What renal failure can cause? Kidney damage can occur either suddenly and as a result of the long-term disease process. If the kidneys are exposed to the damaging factor for a short time, acute renal failure, ONN, develops, characterized by a rapid increase in creatinine and a decrease in diuresis, and even complete anuria, often requiring renal replacement therapy. This condition can develop in a few hours to 7 days. Nevertheless, acute failure may result in full recovery within a few months, and it mainly depends on the type of primary disease. However, if the kidney is damaged gradually through the long process of the disease, lasting at least 3 months, develop chronic kidney disease with the most severe forms, severe chronic kidney failure, and end-stage renal disease requiring dialysis. Among the factors impairing kidney function are primarily the states of impaired blood flow, specific and nonspecific inflammation, and immunological factors and substances toxic to the kidneys. All processes can impair urinary tract patency and chronic diseases such as diabetes and hypertension. Causes of acute renal failure. The factors responsible for acute kidney damage are divided into so-called pre-renal, renal, and renal. The first, most common category includes conditions that disturb kidney blood flow, including decreased circulating the blood volume due to hemorrhage, dehydration, excessive diuresis, seepage into the body cavities, or extensive burns and injuries. Heart disease characterized by a sudden decrease in stroke volume. States of the sudden increase in the volume of the vascular bed due to a vascular tone disorder, sepsis, antihypertensive, electrolyte disturbances, cirrhosis. Autoregulation of renal blood flow due to the use of nonsteroidal anti-inflammatory drugs, cyclooxygenase inhibitors, or angiotensin receptor blockers, drugs used in hypertension. Conditions of excessive blood viscosity, including hematologic malignancies. Obstruction of the vessels supplying the kidneys due to a blood clot, embolism, aneurysm, external pressure, e.g., by a tumor or inflammation. Renal factors that damage organ parenchyma include all glomerular inflammatory processes, autoimmune, allergic, viral, bacterial, idiopathic, systemic vasculitis, thrombotic microangiopathy, cholesterol embolism, malignant hypertension, autoimmune diseases including systemic lupus erythematosus and scleroderma systemic, damage to the renal parenchyma due to prolonged impaired blood supply, toxins, including contrast agents and drugs, including cyclosporin, cisplatin, some antibiotics, captopril, methotrexate, indinavir, acyclovir, ethylene glycol, and methanol, and, attention, popular nonsteroidal drugs anti-inflammatory, as well as cancerous infiltrates. Last but not least, the causes of ONN are conditions that cause obstruction of the urinary tract, also within the bladder, by urolithiasis, blood clots, fragments of damaged nipples, external pressure, e.g. by a cancerous tumor or in diseases of the prostate in men, interruption of the urinary tract, or a damage to the urethra. Causes of chronic renal failure. In contrast